So you want to be an ophthalmologist? Make sure you consider these 5 things before going into ophthalmology. What's up guys, Zach here with Dr. Eyeball MD. If you're new to the channel, I'm a second year ophthalmology resident. So in this video, we're going to be talking about 5 reasons not to go into ophthalmology. Now I'll be honest with you, it was actually really difficult for me to come up with this list. It took me more time than I thought it was going to take because I couldn't come up with 5 reasons. I came up with 4 and then I just took me a really long time to think of 5. If you're thinking about going into ophthalmology, that's kind of a good sign. But in this video, I'm going to give you 5 reasons not to go into ophthalmology. 5 reasons that would maybe steer you to another specialty. Just some things to consider if you are thinking about ophthalmology. So to start off with, what is an ophthalmologist? An ophthalmologist is a medical doctor, so somebody that did 4 years of undergraduate education, 4 years of medical school, and then another 4 years of ophthalmology residency, plus or minus doing a fellowship after that for another 1 to 2 years. So this video is going to be helpful for you if you are maybe a medical student trying to pick a specialty, or you're maybe an undergraduate and you're wondering if you should even go into medicine because you think you want to go into ophthalmology and you have to go through medicine to do that. Reason number 1 is going to be you don't like procedures, you don't like doing surgery. With ophthalmology, it is very surgically heavy. Now it's split between clinic and surgery, but if you don't like procedures, if you don't like working with your hands, ophthalmology is not going to be the specialty for you. So if you're in medical school and you're trying to figure out whether or not you like procedures, you don't always get an opportunity to do a lot of procedures in medical school, but that's something you've really got to figure out is, do you like working with your hands? Do you like doing things that are procedural? Because the specialty is just so heavily procedure based. That's not just in the OR doing actual operations and surgeries on the eyes, but doing things like lasers, doing minor procedures, all kinds of stuff. It's very procedural heavy. Now for me, I like that. I like doing procedures. It's actually my favorite part of the specialty. So if you're really not into procedures and you really like just thinking about things more, coming up with solutions to problems and then enacting them, but not actually fixing things with your hands yourself, then maybe ophthalmology is not the best pick. It's actually funny, one of the things they tell you in medical school when you're trying to decide on a specialty is the first thing is to decide whether you want to do something surgical or something medicine. That's kind of the first fork in the road, is making that decision. But ophthalmology is funny because it actually straddles that line. You have a lot of clinical things and you also have a lot of surgical things, but you definitely have that surgical side of it. So if you don't like it at all, ophthalmology is probably not the best specialty to go into. So up to this point, you've decided that you like doing procedures, you want to do something surgical. So first one is no problem for you. So the second reason to consider that maybe you shouldn't do ophthalmology is you hate clinic. I had a lot of friends in medical school who said they just couldn't do ophthalmology because they hated being in the clinic. They could not stand it. They wanted to be in the hospital. For me, that was the complete opposite. I do not like being in the hospital. I don't like inpatient medicine. I much prefer to be in an outpatient setting in the clinic. But if you're somebody who can't take that clinic setting, you don't like seeing a lot of patients, and you don't mind just addressing a problem right there in the moment, coming up with the solution, and then moving on to the next one. If you don't like that rapid fire kind of thing that you get in the clinic, especially with ophthalmology clinics these days, where some specialists will see upwards of 100 patients. If you don't like the fast pace of clinic that can be the ophthalmology clinic, that is definitely a reason to consider not doing ophthalmology, because despite getting to be in the OR, you have to generate those cases somewhere, and that's done in the clinic. And so if you're somebody that needs to be in the hospital, you want to be doing inpatient medicine, rounding on patients, if that's your thing, ophthalmology is not going to be a specialty for you, because it's just really not something we do a lot in ophthalmology. So up to this point, you like doing procedures, you want to do surgery, you don't mind being in the clinic. So the third thing that I want you to consider before you decide to go into ophthalmology is, do you mind treating mostly well patients? So in ophthalmology, we see a ton of patients that are essentially in a normal, good state of health otherwise, but maybe have just developed a cataract over years of aging with something natural, but basically a completely healthy person that just wants to see better, maybe avoid some issues that the cataracts are causing, but otherwise completely healthy. And so you're going to be seeing people in clinic that aren't necessarily chronically ill, don't have acute problems. You see a lot of well patients in the clinic. That's what I prefer, is to see patients that are mostly well in clinic and that I can help in some way, but not necessarily that are acutely ill or having to manage some really chronic problem. Now there is the side of ophthalmology that offers that too, with things like glaucoma or chronic retinal diseases, that kind of thing. But for the large part, it's a more well patient population in ophthalmology than you get in other parts of medicine. So you're definitely not going to be treating that high acuity patient in the ICU. If you need that adrenaline rush, if you really like that side of medicine, ophthalmology isn't necessarily that, and so that would be one reason to consider not doing ophthalmology. So if you're still with me, you like doing procedures, you don't mind the clinic, and you don't mind the patient population being a healthier patient population in general. So the fourth reason that I want you to consider before you decide to do ophthalmology is going to be, do you mind giving up a large part of medicine to focus on something so specific? So this was actually a big question for me when I was trying to decide whether or not to do ophthalmology, is that I had spent almost 4 years of medical school learning all these different things that as soon as I decided to do ophthalmology, most of that stuff was going to become irrelevant, and I was just going to be focusing on the eye. The question for myself was, would I still feel like a doctor? Because it was just so different from everything that we had been taught in medical school. And in a way, I felt like I was giving up being a doctor. Now that I'm actually in ophthalmology, I realized that I don't feel that way. I still feel like a medical doctor. And a lot of the things that we treat are actually systemic things, and things where that general medical education was actually helpful, because we don't just focus on the eyes. We think about how it relates to the rest of the body and that. But that's definitely something to consider. Do you mind giving up that whole other side of medicine just to focus on the eyeball? All right, guys, so you're still with me. You like doing procedures. You don't mind being in the clinic. You like the well patient population, and I've reassured you that you're probably still going to feel like a doctor as an ophthalmologist because you are one, and even if you give up that bigger side of medicine. So last point to consider is point number 5. Do you mind the volatility of the specialty? What I mean by this is that ophthalmology is such a technology-driven specialty that it is constantly changing. New technologies that come out can completely and drastically alter the way that you practice as a doctor. So if it kind of makes you uneasy to think that some new technology could completely change the way I practice, if that scares you in any way, you got to definitely consider going into ophthalmology, because that's basically what's happened. As ophthalmology advances, we come out with the anti-VEGF drugs, the injections for things like wet AMD, diabetic macular edema, that kind of thing, and it just completely alters the way that retina medicine is practiced. We have Charles Kellman, who goes to the dentist in 1967, gets inspired by the ultrasound machine the dentist is using, turns that into something to remove lenses from the eye, to remove cataracts, and it completely alters the way that cataract surgery is done forever. Things like that, these rapid advancements in technology completely shape the way the field goes, and so there's a lot of flux in the way ophthalmology is practiced just because of that and the nature of it. And personally, I find that super interesting and exciting. I think surgical instrument design is something that I definitely want to pursue in my future. I'm actually working now on a surgical tool, and so I love that ophthalmology is so kind of open and accepting to new technologies, new ideas. It just makes it really exciting for me. If you're somebody who wants to learn the way something's done, and it's been done that way all along in medicine, not a lot of change, ophthalmology is definitely not the field, because it goes in the complete opposite direction. So I hope you guys made it this far and that you weren't deterred by any of those things. And if you weren't, I think ophthalmology is probably a great field for you. I actually had a super hard time coming up with 5, and I know I'm probably biased being in ophthalmology, but it's hard for me to think of a lot more. I'm sure that maybe some people out there can think of more things. I'm sure there are more things. I just couldn't think of them because I think ophthalmology is a great specialty all around. So if you guys are interested to hear reasons to go into ophthalmology, I could make that video. Just let me know down in the comments. I hope you found this video helpful and informative. Just some things to think about before you decide to apply to ophthalmology and go down that road. If you guys got some value from this video, if you did, hit the like button, subscribe to the channel, and I come out with videos to help you guys if you're going to go into medicine, going to go into ophthalmology. We go into all those things. I'm Zach with Dr. Eyeball MD, and I will see you guys in the next video.